So my name is Richa Bisht, and I'm a first-year medical student.
And I'm Brennan Ninesling, and I'm a third-year medical student.
Thank you so much for allowing me to interview you today, Brennan. So my first question is, why did you choose international medicine?
All right. Well, it was kind of a slow developing thing, but I've always been drawn towards underserved communities and working with them back in undergrad, in local clinics, as well as continuing that here in Tampa at the Bridge Clinic. So international medicine kind of focuses on these same communities, like normally in low middle income countries. And so it takes a lot of different factors into account, not just providing care, but also, social determinants of health, underrepresented groups, and patient education. So I naturally felt drawn to that kind of work. And then the scholarly concentration continued to open my eyes to that kind of medicine.
So what type of international work or research have you been involved in?
So over the summer of 2018, for 2 months, both I and another, rising second-year student at the time traveled to Panama. We worked with Dr. Arlene Calvo and the rest of her USF Health Panama team in Panama City. So I think I have a picture of us. So that's us, and then so pretty much we identified barriers and gaps in reproductive health services in the region and surrounding communities in Panama City within the context of Zika virus. So this is us at one of the health centers. And so at that time, safe sex practices was like the official WHO recommendation for avoiding like the adverse Zika pregnancy outcomes.
Mm-hmm.
And so the systems were stressed and needed evaluation. So I have a few more pictures here as well. We did interviews with some of the providers at the clinics, the physicians, the nurses, as well as with the patients themselves. So I do have some pictures of us interviewing the providers.
Awesome.
There we go.
So what were your biggest takeaways from the experience?
So I guess first was just the value of a strong community health center and the community health workers, that assist with all the projects and the interventions. They do have the ability to really impact their community with targeted programs. But I think also just the difficulty of an international project. And really working in one helped me experience that you have to be flexible and you have to be resourceful in that kind of setting.
So what was your favorite part about being in the international medicine scholarly concentration?
I guess there's a lot of things. I think that our group is really close and we really have a lot of fun together. Mm-hmm. So at all the meetings, the talks are interesting, food is good, nothing to complain about. But I think our advisors are one of my favorite parts about the scholarly concentration as well. And you've probably experienced this too. They're extremely accomplished, but they've always been so accessible to students, and they'll work at great lengths to make sure that we accomplish everything that we want to.
Definitely. Yeah, I agree. So what specialty are you going into, and how will you incorporate international medicine into your career?
So the plan right now is medicine pediatrics.
Okay.
I have a wide range of interests, and it really does kind of fit my career goals. I'm actually taking a year off this upcoming year to study global health and epidemiology and get my MPH at the Harvard School of Public Health. And so,
congratulations.
Thanks. Yeah, I decided last week actually, finally committed, but my interests are in non-communicable diseases, like surveilling them and then also intervening in order to, create more complete health care. So I think that the med peds aspect and then the MPH aspects will really, play off one another.
Absolutely. That sounds amazing. Wonderful. Thank you so much. Those are all the questions that I had for you.
Yeah.
Thank you again, Brennan.